Let me just,
Good morning, everyone. It's Tuesday, March 10th and 2026, and we are here for the Housing Subcommittee of the Governor's Autism Advisory Council. Um, so I am calling this meeting to order. We can, if people can take a moment and look at the minutes from the February 10th meeting. And I would need a motion to approve.
it's the first I've seen them, so I just need a minute to read them. Okay, having read the minutes, I am happy to make a motion to approve the minutes.
Okay. And do we
I'll
have a
second
second?
that.
Okay, thank you. All righty. Okay. So next, oops, sorry. Next item on today's agenda is to discuss the housing presentation for our March 18th full council meeting. And then if we have time, it would be great to circle back to what we talked about last meeting around creating the survey questions.
So
Uh,
I can share my screen and if you guys want, instead of everyone accessing it through the share drive, I can
okay.
share so we can make edits and
Great. Yeah, and just resetting, like we're basically said at the last meeting, we don't want to wait until the needs assessment, right? To get information that we need around housing.
Mhm.
Okay,
That was the
Right.
survey that we were discussing.
right.
But this is as we've invited legislators to the March 18th meeting. This is just to do a report out on the housing committee and what your, initiatives are and what you're, looking to do as part of this committee, because we don't really have anything tangible yet to report out. Um,
Right.
so
Mhm.
the legislative committee, as you guys heard yesterday, is going to report out on legislative priorities. Um, I don't like we hadn't really talked about housing in that group as including that as a legislative priority, but we could talk about it in this group as if there's any legislative activities or anything that you would want to be engaged in as part of that. We can surely add that in here for whatever. And I just did blank. I can make these look nice later once we agree on content.
Mhm.
So I started off by this is to make it similar to what they're doing in the legislative committee, starting off with our objectives. This is the overall responsibility of the council. And then if you want to add, I kind of just put this one in as a placeholder, but if there's additional things that you guys would want to add as kind of your objectives for this subcommittee.
Yeah, I would suggest adding a range, a range of affordable and supportive housing models, right? And that's speaking to our prior discussions about no one size fits all. So we're
Mhm.
looking for housing that covers the spectrum of different needs and interests. Do you agree with that? Like
I
other
do.
people in the committee?
I definitely do.
Yeah, it's no one specific model. It's a range of options that are responsive to need identified.
Mhm. Mhm.
Do you want me to add at the end that meets individual needs or the unique needs of each person or something like along those lines?
Yeah, I think so. What do others think? I
Is
mean,
it is it just to identify them or is it to increase?
Well, I was thinking if you wanted to add, you could add another line about what you would like to advocate for, or
mhm,
how I mean, right now I felt like you were kind of doing more of that exploring process on
Yes.
what to, but I'm happy to change that language to whatever you guys feel suits your activities.
yeah, I think that's what we've talked about in the last two meetings is it's not just the supply side, it's knowing what the community wants, a community of people with autism. And so
Mhm.
it's both. It's like, what are those best practice models that are responsive to the demands and interests that people are communicating to us if we're
Right,
to do this survey or whatever? It's like, it's both.
right. I was only asking that as a point of clarification because identifying a range of affordable makes me feel when I read that we are locating them, like where they exist. And I
Mhm.
don't know that that range does exist. So I
Right.
just want to be clear to our
Mm,
legislators that it is not just about identifying where they are and pointing people in the right direction. You know what I'm saying? Does
Yeah,
that?
maybe it's identifying the types of models,
Yes, yeah.
right?
I think
Okay.
that that's closer to what we're trying to
I
do.
w- I
We're
was just
in
gonna say
partner.
that.
Sorry.
Sorry.
No, no, it's okay. I was going to say in partnership with the autism community,
Yes.
Yes.
identifying,
Yes. I like
or
that.
articulating the needs as expressed, that sort of thing, and then hopefully increasing
Hmm.
access
Yeah.
to those safe
Yeah.
and affordable and supportive.
Yeah. Because some of
Yeah.
them, some we've already identified a couple, but like they may not exist now. So
Right.
we can't identify them locally because they may not exist, but we can identify best practices that are
Yeah.
suitable for people
Yes.
we've heard, right?
Right.
Yeah.
Right. Do we want to add any, because I was looking back at things we talked about in our previous two meetings. Would we want to be looking for ways to create housing partnerships, like maybe with other community resources,
Hmm.
Hmm.
I
as
agree.
well? Would people feel comfortable if we put that as an objective? Um, because we talked about the idea of if, because we have to still think about like funding sources and, and also for if housing was identified for folks who might need some more support
Hmm.
in that particular housing area, what would like would there be a community agency or who would want to partner up and be part of being able to carry out the care or the
Yeah.
supervision or whatever the individuals themselves identify as um,
Yeah.
the
Yeah.
support
It's
they need.
only quite recently that there are these bundled kinds of arrangements where the housing supply and the services are all in one. And
Mhm.
I think that there, yeah, so it like has to do with portability, right? Like if people are unhappy with their services, but they love where they live, I mean, I could see that playing out and vice versa.
Mhm.
They love their services, but not where they live. So I think we want to unpack that a little bit around partnerships and say, create, yeah, partnerships and or collaborative opportunities with the
Mhm.
affordable housing sector and
Mm.
service provision, service
Yeah.
providers or something like
Programs.
that,
Yes.
recognizing the sort of the ecology of the various stakeholder groups.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah, I think I mean, in just listening to what you all have said, I think it's about, and this is a big, a big task, but sort of coordinating uh,
Hmm.
the not just like identifying, but also maybe some housing development opportunities
Exactly.
and community partnerships and support services. So the coordination of kind of those elements of individuals' experiences is critical to, developing a range of affordable, supportive housing models
Yeah.
that meet those individuals' needs.
Could we
Yes.
add a bullet under that that's something to the effect of influence the supply of
Mm.
housing opportunities? Like,
Ooh, I like the word influence.
yeah. Yeah, I mean I think what we have is influence with this committee. Like we want to affect supply. We did that this year with our priorities. Normally we advocate for people's housing rights, but I inserted we're going to try to influence the supply, not
I want
just
to I want to influence in an expansive
right.
direction.
Mhm.
Yes. Yeah. Yeah. The range or expansive
Maybe
model.
maybe influence the expansion of housing opportunities.
Mm-hmm. Yep.
And and how about something, I just need to talk this through out loud for a second. So when we talk about the examination, that do we want to put in an objective that we are, I need to think for a second. We are like through a survey, we are gathering like information and data on individuals' needs and wants, like directly from the consumers and their families themselves.
On the next
And-
slide, I have
Oh, you do? Okay.
a
And how?
placeholder for
Thank you.
the current
Okay.
initiative. So this
Okay.
I was thinking of just kind of this being the
The
bullets
over.
of the
Okay.
overall objectives that you would like to achieve.
Got it. I see.
But
Okay.
I think it is important, just kind of like I was saying in yesterday's meeting, I think it is important to state what are the objectives, but then link them to the methods by which we hope to,
Mhm.
aim to, plan to, intend to
Mhm.
meet those objectives. Like, what is the how of it all?
Mhm.
So I wonder with that first bullet if we should say examine the range of affordable and supportive housing models for adults with autism that exist and or are optimal. Is something it's like both ways. Like what do we have now versus what do people want? It's like it's both that here's the housing stock, but then this is what people want. It's like
Well, I
a twofold thing.
I think
Yeah.
Toby kind of, if we were to reorder the bullets, it would be the
Yeah.
examination, then the influence, the expansion of those housing opportunities. That would
Yep.
Then
probably follow logically, right?
create,
Yep.
yeah, then
And
would create the
creating, right?
Great.
So,
yeah,
Yep.
I
Perfect.
agree.
That sounds great.
So I'm sorry, I missed that current order, or you want me to
so
reorder?
examine, influence, create.
Yep.
Mhm. Mhm. Mhm.
That's great. We're like a small group, but we're getting a lot of work done.
I was gonna say, I know that's so strange you say that, Toby, because I was literally just thinking that. Like,
Yeah.
I know I think there's a lot of passion and commitment. So I think we're, yes.
Sometimes it
Yeah,
only takes a
Schumacher,
few, right?
small is beautiful. It's his
Yes.
famous quote.
Yep. Mm-hmm.
I really like those as objectives. I think those
I
are quite good.
I agree. And Carrie, when you so succinctly put it and said examine, influence, create, it was kind of neat to just hear it, just that, you know what I
Agreed.
mean? I
Yeah, yeah,
liked even just hearing that as the flow. Those are great verbs there. Examine,
yeah.
influence, create. Like,
Yep.
because
Okay.
that is what we're I think if you had to sum it up in a couple of words, I think that
Mhm.
sums it up really
Yeah,
nicely.
I think it's great.
Hmm. Okay.
So, and just a reminder too, when you're speaking to this, we currently do not have any residential options within the adult autism waiver. So that's something you can speak to in the next
Okay.
point as to why you're picking up these.
Mhm.
Just a side note.
You mean why the committee is formed?
Well, yeah, and why it's important because we currently don't have any
Mhm.
in the state, that's
Yes.
attached to, like Department of Housing doesn't have anything specific to, people with
Right.
autism. There might be some overlap in DMIS for those who have autism and are utilizing behavioral health services, and they could be, in that system. But there is no one agency that's holding up autism housing in the state.
I feel
Yes.
like we need some talking points, like before this. I know that this is sort of in preparation of that, but like, I'm just being transparent. I'm not as fully aware of all of those. I know that there are limitations, like you just mentioned, but like I feel like as a group, we might want to, or you, both of you, Carrie and Melissa may be able to like speak to all these facts, but like if I'm providing comment, I like to be able to have reference points,
No,
um,
Mhm.
along those lines. And maybe we'll get there with this presentation, but
No, I totally agree. And I also did want to ask, Toby and Carrie, are you planning to come in person to the meeting next Wednesday?
hmm
I can, yeah. Is it at the LOB?
Mm-hmm.
Okay, let me just get that on my calendar.
Um,
And is it it's the time that's already on our calendar, right?
Yeah, 10 a.m. to 12. And there is
Okay,
a virtual option. So even if you're joining virtually, you'll still be able to present. And the room will be able to see
okay,
people on screen. So
okay. All right, great. All right, no, I'll be there in person.
is it the same room at the legislature where we held the last one that was in person? Were you there?
I
Terry, you were
can't,
there, correct?
I was there, but I can't remember which room it was that we were in. But
Okay.
it's going to be like right when you walk in, it's on the
Yeah.
first floor. It's going
Yeah.
to, I believe it's right into your right.
Okay.
So it's
We
not
were,
too hard to find.
yeah, we were in one that like if you could have walked straight ahead from the door, it was
Mm-hmm.
back there.
Yeah, it's
So,
gonna, yeah.
okay.
So for your next slide, then, am I hearing you say you wanted to do something more on like your why, or do you want to do the why according to the initiatives? I'm happy to do whatever I add.
hmm hmm
Just let me know.
Right. So the question then is do we want to make that statement that currently there is no, so, I'm thinking of it like almost like a flow. Like if we start with like, okay, currently we don't have any housing that is designated specifically for individuals with autism. There are housing options for like just like the way Tara said it, for individuals who access behavioral health resources through DMIS are able to have, to have some, are able to have housing options. However, we currently have no housing options for individuals that solely with the sole focus of it being individuals with autism. And that I don't know if we want to say that the parents there is a group now where the parents are aging and and there is, there's a lot of anxiety around that for families and the individuals themselves.
Well, and
Yeah.
just to add to your statement, like we know that housing vouchers maybe have long wait lists. Like we
That
we
too.
like there are places people could live if they could get access. Like, but
Yes.
we can't really quantify the problem yet, right?
Mhm.
And it's both sides. It's the housing stock as well as the support services people may need. It's both. So I think we're right now trying to come up with a way to
Mhm.
articulate the problem statement, like, because we don't even really know the extent of the problem, really.
Right.
Like, we don't know
Mm,
even know the demand that, like, we have this anecdotal information, but we need more information. That's the problem.
Mhm.
mhm.
Yeah. So I think
Tara,
it's
would you mind identifying RAP?
Rental assistance program. So it's like the
Oh, okay.
Section 8.
Oh,
So
that's what it's
the
okay.
mhm.
Yeah, this is helpful, Tara, with you putting the bullets in.
Yes, very
great.
program.
I'm just trying to capture what you guys are saying. It's
Yeah,
cool.
you're doing great.
But I think the point that you just made, Toby, about we and you too, Melissa, with respect to like we are aware, and you are probably very aware with your clients, um, of the degree to which this is causing anxiety among our folks. But also, there is this aging population of parents, and obviously paired with that is an aging population of adults with autism, who
Hmm.
continue to present with needs that for which they don't have access to housing and or supported housing, whatever we're
Right,
expecting in that. But we don't, that coupled with the fact that we really don't have any hard data to speak
right,
to speak to the problem, right? These
right,
are these are kind of anecdotal
right.
data at this point, but we need some compelling evidence in the form of kind of hard, firm data collected from the population in order to leverage that and compel
Yeah,
some
t
action.
this raises another question for me. I was at a meeting a couple weeks ago and I met the Connecticut's GIS data guru.
Hmm.
I don't know, Tara, if you know him, and I can't remember his name, and he didn't have a business card, but I want to follow up with him. He's doing geographical spacing on lots of things.
Which
Um,
agency
I can't remember, but he's basically he's in charge of GIS mapping for the state.
was it?
So I,
Scott
I think
Gall?
he's with IT, I think.
Oh, okay.
And we don't need to like go there yet, but I mean, we might want to like look at some of that mapping somehow, which is going to be, I'm told it's public. Like it's public data. So like people will have the opportunity to go in and interact with
Mhm.
geospatial coding to like map things. That's what he told me.
And I think the needs assessment will have questions on housing,
Great,
caregiver ages,
great.
all of that kind of stuff. And what we are looking to do is to have a um, data dashboard where that information, the results, and so it's not like a geo mapping kind of thing, but it's the results of the survey and what area they're coming from,
Yeah,
that will identify, um, some of those top level needs that people have identified, but that's, we're still
that's great.
a little
Yeah.
while out from all of that.
Yeah, I'm just thinking like, for a long time, Policy Map out of Pennsylvania has had the software that allows people to locate housing supply, affordable housing supply, Section 8 vouchers, things like that. And if we knew like the density of the population of people with autism in the state, we could actually look, is there a match or a mismatch? I'm getting into the weeds, but that's kind of the way I approach problem
Yeah.
analysis.
And currently, we don't have any kind of autism census or autism specific data because you're
Right.
just using,
Yep.
like the American community, surveys and
Survey.
that kind of thing. That there's not really anything
Mm-hmm.
that I know of that's occurred
Yep.
statewide to, identify. I mean, we have numbers, on site of number of kids with autism identified, but again, that's just those who are receiving special education. So it's not like the whole array, so, and it's not mapping or anything like that that we could use for housing.
Yeah,
The other,
before I came here at this job, I was directing a CDC study looking at a surveillance, like a public health surveillance of people with IDD, that would basically people had the choice to identify themselves or not in primary care settings. It got nixed by the current administration and why, I'm not doing that and I'm doing this instead. But that's one of the limitations, as we all know, with the regular data is that we don't identify people with disabilities on all, population measures. So we're limited.
Tara, could you go back to the second slide for a moment? I'm wondering, examine the range of, could we add safe in there? I don't know how you all feel
Yes,
about that.
I
Safe,
agree.
affordable, and supportive housing.
Mhm.
Because that's another issue that sadly I have encountered.
No, I agree
Is
with you.
the vulnerability piece, which is another reason, and I have, firsthand, you know, anecdotal information around that of, due to the sometimes trusting nature of folks and the vulnerability and the misreading of a social situation at times, sometimes then becomes an unsafe situation. So if people are okay with that, I would like that word in there, if that's okay with everyone.
I completely agree with that.
I
Um,
worry a little bit about the word safe because like a big issue is the dignity of risk. So I understand why you're saying that. I'm also a parent, so I understand why you're saying it. But like, I wonder if we could, and I don't want to try to wordsmith here, but
no, yeah, is
you're
there
trying
another
to
word?
you're trying to manage risk, right? Um, because
So,
people,
Toby, say more about what you think, what do you think, what you mean by dignity of risk? I'll just ask it that way.
Yeah.
meaning that there are parents that will make decisions for their kids because they want them to be safe and they're not actually making their own decisions about things. It's to me, it's about managing risk. Like someone could live in whatever neighborhood that maybe has a high crime rate, but if they had the right supports in place to mitigate those risks because of the systems that their support team put in place, they could
Mm.
live there. So I'm
Hmm.
just worried about saying, okay, you have to all live in a gated community because you're going to be safe there versus like opening up these other opportunities that could afford the opportunity to live in housing in the community.
Okay.
So safe,
Okay.
I don't see safe as being, um, I don't want to rule out settings that could otherwise be possible if the right safeguards were put in place in that individual team, is what I'm saying.
So maybe
Okay.
it's not, I hear what you're saying, and I understand that. I guess safe doesn't conjure that up automatically
Right.
for me, but I hear what you're saying. So maybe it's about adding or qualifying that statement to say that, um, promote independence
Yeah.
and quality of life or something of that nature, so that it's
Mhm.
not restrictive, but that it suggests that safety is associated with the degree, also promoting independence and quality of life.
Yeah, something like with,
Choice, I would.
yeah, examine the range of affordable and supportive housing models for adults with autism spectrum disorder, um, that currently exist in the system that provide the supports and services needed or something like that. Like, and
Needed.
safety is
And
part of that.
right, because I'm also thinking then another word sometimes that I use in lieu of safety is to say that also like promote like self-advocacy, like, so that you have the ability
That
to,
dignity of risk, yeah.
yeah, to advocate for what you may need in any given situation.
Yeah, and just personal example, my daughter, she's an intellectual disability. I'm working from home today. I'll be in Connecticut tomorrow, but um she you know, she can't drive and she is not willing to learn how to drive because she's too nervous to learn how to drive. And we have an Uber line item in her self-direction service budget to take Uber wherever she wants to go. I freak out at the idea of her having an Uber driver. So we have things like when she absolutely has to take Uber because her direct support calls out sick, she's on FaceTime with me, the whole time. I know what the license plate number is, things like that. Otherwise, she wouldn't be taking Uber,
Mhm.
you know?
Mhm.
Mhm. Yeah.
Right. So that I think that's kind of I think you summed that up to it. Like that's what I think I'm trying to say that like an environment that yes can allow the individual to explore and explore independence, be independent with also like some
It's
assistance in place should it
Do you think
be
this is
needed.
better under create because we
Yeah, that's what I was
currently don't
thinking before
have?
when you were typing that. I agree.
Yeah.
Okay.
Yeah,
Right,
So
you're
because we're
right.
not just examining, because
Yeah,
Right.
agree. I
Okay.
agree.
um I'm wondering, Melissa, if it's like a degree of choice or self-direction
Mm-hmm.
Yes.
that you're
Yes.
speaking. Okay. So
I like that.
yeah,
I
I
do
get
too.
that. And I think we have to, I mean, maybe this is more than just what we're presenting to, you know, to the legislators who are present, but I think we have to, there is language that probably we're more familiar with than perhaps legislators are. So,
Right.
you know, e- ex
Self-efficacy.
employing, yeah,
Hmm.
exactly.
Hmm.
Employing language that's accessible.
Yeah, what is that?
Yeah, exactly. Just like, I asked for you to define for me dignity of risk and what you meant by
Mhm.
that. I think that's a really important,
True.
I think that's really important as you described it. And I might not have, I certainly wouldn't have come up with that. I would have, come up with an alternative term like, I don't know, maybe self-direction or independent, independent
Hmm.
or
Hmm.
choice, something of that nature. But anyway, I think that that also leads us to like then the how if we do this. But before we get there, I wonder with the next slide with the problem statement piece, if again we could kind of bolster that by identifying what are the potential eventualities, I guess, of these needs not being met. Like what happens to people when,
Great point.
right?
It is
What a great
regression,
point.
number one, right? Total regression.
Hmm.
Because I
Eternal parenting,
Hmm.
like just
Yes.
and
Yes.
I hasten to say it this way, but in fact, I think it does need to be said this way for some people. There is a greater draw on our systems when people regress and have higher degrees of needs. Obviously, my first, maybe not obviously, but obviously to me, my first concern is about the well-being of the individuals, but also it does impact our systems, right? And so people
yeah,
who are
Yes.
taxpayers who aren't affected by this and um, on a personal level are
right.
impacted by it on a systems level, right? So
Hmm.
I
Yeah.
think
And
that's
just
maybe.
and
Right. And
just
I think it is important to spell these things out because I don't think we can assume, you know what I mean? Like even, when I'm talking even with other therapists sometimes, they don't you know, and I'll explain something like something like this, and these are, therapists are a group of people who, you know, really are pretty in tune with,
Mhm.
Yeah.
needs of different populations and things like that. But they say like, oh, wow, I didn't even know that, or thank you for educating me, or, you know what I mean? So I
Right.
think I think coming at this presentation with the idea of we're speaking to someone who really may not know,
Yeah.
who
And
may know close to nothing. And I think
and
that's a good way to approach it.
and think about, transition age youth, where we're trying to promote transition in high school with measurable post-secondary outcomes, who
Mhm.
they leave probably at their most optimal if provided those opportunities, and then they sit at home on the couch because
Yeah.
they don't have services. So it's also potential lack of productivity,
Yes.
Mhm.
lack of like the big thing is like just they're not keeping pace with their same age peers without
Right.
disabilities. They're
Exactly.
limited.
Or, kind of continuing on the trajectory that would have been anticipated given the gains they
Right,
make up to a certain point, right? Just sort of speaks to the cliff that we reference pretty regularly, right? When
right.
folks reach a certain age. The other thing that I might suggest, Tara, is like the what happens to people when we don't meet these needs and create opportunity is kind of what happens to them individually or as a group, but also then so that it's sort of like two tiers, if you will, like what happens to the individual and then also how that impacts others, within the community. So like the draws on the system. And also we have a drawl, which might be like a
Oh,
sub
sorry.
drawl or
I was wondering about that too. Or you so yeah.
My bad.
it's just
And
not
I
spell
wouldn't
check
call
isn't
it
going to pick it up.
No.
and I wouldn't call it job supports. I would say lack of job supports.
Yeah.
Yeah, I was just throwing in examples
Yeah.
as you were
Yeah.
discussing.
But then also for the person who may have had a great
Yeah.
primary education or secondary education. I mean, what happens to them, their mental health and like their place in the world? Like, okay, all my peers are leaving,
Right.
they're going on to college, they're going on to jobs, they have a path. What am I doing? I know that really affected my own daughter. Like,
Mm-hmm.
yeah, we gave parties to all of her friends that went on to college, and she's like, well, what am I doing? I'm stuck in school for 2 more years.
Yeah.
Like
Yeah.
it's
I'm at
it's
that
really
crossroads
important.
right now, Toby.
Mm.
Yeah, it's
Just
like
said the
life.
same thing. Yeah.
Yeah.
Yeah, life course issues. Like,
Yeah, for
who am
sure.
I? Like, why am I here? It's
Mhm.
not. It's a very sad time for a lot of kids that are everyone else is leaving and going on to other things, and they're not.
Hmm. Yeah, absolutely. And I think that speaks to the importance of not just, there being access to housing, but that housing is actually um community or connected to community, right? Or to
Yeah,
some degree, like to the extent that people want such, but like, access to public transportation to kind of continue with your, so the supports are not necessarily direct supports, but access as well, depending on, what
yeah.
desires of the
Social
individual are.
connections. I put social connections in there, community
Mhm.
participation, like
Yes,
relationships, social relationships.
exactly.
Mm-hmm.
Right.
Yeah.
Sorry, I'm talking so much. I'll be
No,
quiet.
no, this is
Great.
wonderful. This is good. And I'm hoping the reason why I had asked, I don't think I finished my thought before. The reason why I had asked if you both were coming in person was because I was hoping we could all, I mean, Tara, are we allowed to like all stand together and present or
Yeah, and if you guys wanted to continue to discuss and have, work on this, that's fine too, outside of
Mhm.
this specific meeting, because
Yeah, we only have 7 minutes left.
I know.
I was just going to say
Great though.
we are going to I put this as, your independent. We can do, you can discuss like the independent survey you would like to do, and then also how the needs assessment can support that.
Great.
Mhm.
But I would say, um, making this more of a statement that you would read, like you know, or I mean, you can do bullet points, but um, however you want to divvy all of this up. I
Mhm.
mean, this may be better on a separate slide.
Mhm. Yeah, I think so
Um,
too. Kind of the outcomes, problem statement,
Outcomes,
potential
right.
yeah.
outcomes. Yeah. The other thing too is, I mean, I feel like a broken record. I'm probably repeating myself from yesterday, but I also think when you kind of infuse this with, some statistics, some sort of hard facts, right? About like, I can think of just one, but like of the, um, 13 disability categories that we identify, autism has the lowest, like the highest underemployment rate and the lowest employment rates. And
Right.
it does have to do with housing and community and supports and access. And, all of it is like a very complicated, intertwined
Hmm.
set of factors. But, there are many folks in this population who are clearly employable.
Yes, for
Hmm.
sure.
And so there's a mismatch, right, when we think
Hmm.
about those.
Well, that raises the other, Tara, what is the status? I thought there were like three subcommittees. Isn't one education and training,
Yes,
like
and
employment?
they haven't met. I think Gemina was because she chairs, I think she volunteered to chair, but there's, she's already chairing ASDAC, so
Mm.
they haven't reorganized since we lost Lynn.
Yeah, if any, I have people at my shop that could help if you're looking for more members to support that committee. We certainly can help with that because it's really important for us
I
to
I
see that.
think according to the bylaws, we have to have a member chair, but
Okay.
then non-members can fully participate in
Okay.
subcommittees, and there's nothing in the bylaws that prohibits any of that participation. So I think that it
Great.
would be great. She knew that she had help,
Okay.
to do some of that. That I think that it would be maybe a little easier to get it off the ground.
So as a member, who do I email just to let her know that we can offer support through another?
You can email Gemina and directly. Do you have her email?
I'm not sure. If you could send it to me, I'll email her.
Sure.
Thanks.
Okay.
So you guys can continue to clean this up and add, and then, everyone has access. And I would just kind of encourage you to like close with an ask to legislators. How do you see them playing a role in some of these? Is there, even if you don't have a specific legislative ask, maybe how do you foresee this subcommittee maybe providing education or being a resource to maybe review proposed legislation, any legislation or bills that get put out? So just think of maybe something that you would want to present as a.
I looked at the housing bill and I don't feel prepared enough to testify other than to participate in this meeting. But like
Mhm.
one thing that would be helpful, and I'd like to know what other people think, would be for legislators who are part of this committee who may know people in housing to help us make those connections
Yes.
with housing.
Yeah, I agree.
And I did look up the housing committee people, but
Mhm.
there's only so deep I can go right now with a lot of stuff.
Mhm.
I mean, this work intersects with so many different priority areas, really. I mean, it's housing, it's health and human services, it's transportation. That's the thing. It never fails to amaze me how multidisciplinary disability policy is.
Mm-hmm.
I have to go to a staff meeting. Do you want to try to
Yes,
meet again before Wednesday as a subgroup or
we probably,
committee?
yeah, I think we should. Um, And also I am not available Tuesday, April 14th, which would be the second Tuesday. So I'm not sure then if we want to say we're going to meet May 12th, or that would be our next, if we don't meet April, unless we want to meet another time in April, but
I'm open to meeting another time if others are.
Sure.
So we still can have our monthly meeting, just not the
right, still stay
time.
on it. Okay.
I
Um,
do have to hop into another meeting, which is
I
I
know,
do
me
too.
too.
so
I do
Um,
too.
I'm
maybe
happy
I
to
could,
send out an invite, or send some potential dates and times. I'm also putting in the chat a link that I saw today. So Advancing States has a models for housing providers. It's a
Great.
training, so you guys
Great.
can click on
thank
that.
you.
Great.
And
Thanks for your
we'll be in
help, Tara. You're
touch
great.
in
I
email.
know,
Thank
Tara,
you.
thank you for,
No
I don't know
problem.
how we'd,
Excellent.
all right, so it sounds like then I'll
We can do it through
email
email.
everybody because we'd like to try to meet before next Wednesday, and we need a date for April.
Sounds great.
So
Okay.
I will send that out.
I
Thank
will
you,
tell you, I
Melissa.
am not going to be available Monday and Tuesday of next week because I'm going to be out of state. But
Okay.
if we can get it in this week, great. Or you want to meet without me, great. I'm
Okay.
fine either way.
Thanks, Carrie. Bye,
Thank you,
everybody.
everyone.
Thanks,
All right.
Kara.
Bye.
Yep.
Thank you, Tara.